Before you start, exercise caution. You should always speak with your doctor before you start, stop, or change any part of your healthcare plan, including physical activity, exercise, or therapy. This video cannot and does not contain healthcare advice. It is for general informational and educational purposes only. Use of WhisperSLYDE is solely at your own risk.
Supine bed hamstrings. So the WhisperSLYDE is towards the end of the bed. Really doesn't need too much fixation because the buttocks are going to be resting on the end, covered by a pillow for comfort. She's going to lie up there on her back. It's been preset. You can see the foot position, and now she's going to do 10 reps. Supine hamstrings on the treatment table. So you can see how she's positioning the head pillow. The second pillow is going for comfort over the base, which will actually stop the WhisperSLYDE sliding up the bed. She hooks her foot under, lying there, and is going to do 10 reps. Supine knee extension. You can see here that it's on the treatment table, but it's fixated via the post up the head end, and this can be fixated in many different ways, but you're going to need a manual therapy belt for this. So we're going to lie in supine there. Perfect. So now you're just going to do 5 reps or 10 reps, whichever band resistance you're using. Hip extension diagonal. So we're getting the hip abductors working and the hip extenders using the chair for balance. She's going to repeat this 10 times. Hip extension erect, but using the chair for balance. Notice how the support leg is slightly soft with the knee bent. She's pushing back 10 times. Using the chair, this is hip extension with flexion, getting the gluteals coming in. Her base is hip width apart for stability, and she's going to repeat this 10 times. Trunk is flexed to 40 degrees. Sitting lateral rotation to the right hip. The idea is that the foot comes across and the upper leg rotates without the knee moving too much across. And repeat this 10 times. Sitting medial rotation of the right hip, and the idea is to rotate the foot out so the thigh is rotating in, and that's why she's holding her knee to try and minimize the side movement of the knee. You may need the WhisperSLYDE fixated on that right side, the left of the screen, to stop it sliding. Wide hip pushbacks. So the foot is standing at hip width wide, forefoot is on the buffer pushing back, and the hips remaining relatively still with the knees slightly bent. This is central hip push out, so the knees are slightly bent, the stabilizing foot is on the head of the board, and we're just pushing out and keeping the pelvis stable. Sitting hip lateral rotation, the WhisperSLYDE is held against the wall. The idea is to have the thigh not move too much and just rotate, and the ankle is coming in. There's some adduction here as well. This is sitting hip internal rotation. The idea is that the knee doesn't travel too far to the side, and the top part of your thigh is just rotating as the ankle goes out to the side. Sitting double hamstring, so the heels are on the buffer, they're pulling back, sitting on the edge of the chair, and the WhisperSLYDE is fixated to a table with the strap. Sitting hamstring curls. This requires the WhisperSLYDE to be fixated to a table chair or something so it won't slide back. Here we are using a belt around the table, and now we can pull back using hamstrings. Double knee extension sitting. Notice the heels are in, the toes are up, and either pushing out or one knee can control the other. This is hip flexion, so we make sure that the support of the standing leg is halfway down the WhisperSLYDE, and the action is we're making the left hip pull the left hip forward into hip flexion on the left. So this is resisted left hip flexion. The WhisperSLYDE is held against the wall. You're going to repeat 10 times. So this is hip flexion, so we make sure that the standing leg is halfway down the slide, so we're making the right hip flexors pull the right leg up towards the left leg and back, and we're going to repeat this 10 times. Need to make sure she's hanging on to something stable and the WhisperSLYDE is held against the wall. So this is hip extension oblique, which is affecting the lateral rotators, the hip extenders, and the abductors. So she's standing at like a 45-degree angle, and she's going to repeat 10 times. This is hip oblique extension. So Kathy's standing at a slight angle, so she's pushing out and backwards. So we're going to repeat that 10 times, standing on the left leg, active leg is the right. This gets the gluteals working, lateral rotators, and hip abductors and extenders. Repeat 10 times. So we're doing pullback. This time the active leg is the left leg standing on the right. She's standing halfway down the slide, so the hamstrings are engaged. So just pull on back, Kathy, so you're going to do that 10 times. That's good. So this is hip pullback, mainly using the hamstrings. So the main thing is to have your foot about halfway down the slide, which Kathy does, standing on her good leg, and she's going to pull the right one back. And repeat about 5 times, 10 times. So this is the pushback for the left hip with her trunk bent forward to make the gluteals work more. So the leg working the most is going to be the left, although the right is stabilizing. We'd repeat this 10 times.
This knee's supposed to be bent.
So both knees are slightly bent. This is hip extension with the trunk flex. So just bend on forward, Kathy. Just come on over the chair a bit. There you go. And now push on back. And you're going to repeat this 10 times. The fact that she's bent forward makes more of the gluteals work. So doing hip pushback with the left leg standing on the right. The affected leg would be the left. So you're just pushing back at your own pace. And we're going to do that 10 times, keeping your pelvis reasonably still. That's good. Stabilized, obviously, with the chair. This is hip pushback, so you're just standing on your good leg, which is on the left, and now just sort of keeping your hips still. Kathy, just going to push it back. There we go, good. There, stop there, good, and come forward, and you're going to do it 10 times. doing hip push-outs. So she's standing on her good leg, which is the right, keeping the pelvis reasonably stable, pushing out as far as she can comfortably go. The knees are slightly bent, and she's going to repeat this 10 times. So sitting hamstrings, the WhisperSLYDE is stabilized with the belt and the leg of the couch, and she's pulling back with both legs. She's going to repeat 10 times. For the left hamstring, the WhisperSLYDE is held against the couch with a belt stabilizing so it won't slide back. She's using her left leg, obviously, pulling back, repeating 10 times. So this is right-sided hamstring, and what we've done is secured the board with just a regular belt around something sturdy like the base of the couch. She's hooking her heel under and repeating 10 times for the right leg. This is sitting lateral rotation of the left leg. The WhisperSLYDE is WhisperSLYDE. This is sitting lateral rotation, and then we have the WhisperSLYDE stabilized against the wall. There's minimal adduction of the hip. It's mostly just lateral rotation. I'm going to repeat 10 times. Okay, we're doing medial rotation of the hip sitting. This is the left hip, and then the idea is we're rotating into medial rotation. There's some abduction going out to the side here as well, and we're going to repeat 10 times. So the WhisperSLYDE is held against the wall. We're doing medial rotation of the hip. The idea is the femur just rotates and the foot moves out, and there's a little bit of abduction there. She's going to repeat 10 times. Sitting quads push out. This is bilateral, so she's sitting right on the edge of the chair. The board is stabilized against the wall. The heels are on the buttress. The toes are up so they won't slip. She's going to repeat this 10 times. So this is sitting quads push out on the left. The foot is on the buttress. She's going to repeat this 10 times. The WhisperSLYDE is against the wall for stabilization. Quads push out on the right, so you're just pushing on out. And then when you keep your toes up, then it won't slide off the buttress. So you're going to repeat that 10 times. So this is sitting quads push out. Notice how the chair is in the hole. So the left leg of the chair is in the hole for the left leg. So she's pushing out. She's going to repeat this 10 times and doesn't need the WhisperSLYDE stabilized against the wall. This is quads push out sitting, and notice how the leg of the chair is in the hole on the end plate for stabilization, so you don't need a wall to stop the WhisperSLYDE moving away as you resist. She's going to repeat this 10 times.